Well, thank you for spending part of your afternoon with Twin Cities Live. Kevin Dorn is filling in for Ben Lieber today.
Happy. Thank you for the opportunity.
So nice to have you here. Ben is going to be back here tomorrow. Of course, he's traveling with the Vikings. Okay, so the last time Dr. Chu from Chu Vision was here in our studio, he told us about cataracts and then cataract surgery. And then afterwards, not surprisingly, his team was overwhelmed by the number of TCLers who called with questions and they wanted additional information. And they probably, because we love TCLers, they were like, Dr. Chu is now my friend because I saw my TCL, so I'm going to invite him to Thanksgiving too.
And we thank our TCL watchers for asking all those questions.
Yes.
So we brought Dr. Chu back to answer all your questions for a segment we're calling Ask Dr. Chu.
Here's the man with the plan. Hi, Dr. Chu.
Thanks for being here.
Hi, thanks, Elizabeth and Kevin.
So what happened? Everybody called and they were all like, oh my gosh, I need help.
Yeah, and I'm happy because I love food, so bring on the Thanksgiving.
He might come if you invite him.
So we're talking about cataracts today. And I had mentioned earlier, I think if you don't have them when you're younger, most of us grow into it. Is that the case?
Yeah, it's really part of the natural aging process of the eye. Everyone, if they, if you live long enough, you're going to have some cataract symptoms.
So who's eligible? Who's a candidate for cataract surgery?
When you start having trouble seeing in dark, needing more light to read, you might have glare and halo from headlights, those are the first signs that people have, might be having cataract symptoms.
And what is it? Like, what is the actual cataract? It's not a cat.
Exactly. Yep. And people think it's like a film growing over the eye, but it's actually a clouding of the natural lens inside the eye. So if the eye's like a camera, it's the lens getting clouder as we get older.
So you notice it like via your vision before you notice it when you see, because like you always see animal, you see dogs that get a cataract.
Yep.
You'll notice it inside your own vision before you'll see the outside change.
Absolutely. So it got the name cataract. Cataract means waterfall. So in the old days when the surgical techniques weren't good, the eyes became white. So you could actually see a white spot in somebody's eye. That's the cataract, and that's dogs and animals. Now, we have so many demands on our vision, seeing cell phones and screens. People come in much earlier. They're starting to say, I just can't see when I need to read and things like that. So, yeah, you won't see a white spot in their eye, but they'll just complain of blurriness of vision.
How big a deal is the surgery?
It's come a long way. Before it was much more involved. Nowadays, it takes less than 10 minutes. It does not hurt. You get to be asleep for the surgery, so you won't see or feel anything coming towards your face. Yeah. And 99% of people don't even need Tylenol or Advil after the procedure.
Oh my gosh. Now, a lot of people are going to wonder if they're like me and they had LASIK.
Yeah.
Can you still get cataract surgery, or will you need it if you've had LASIK?
That's an excellent question that comes up all the time. And the answer is yes. So LASIK was done on a different part of the eye, and so it's done on the cornea. So there's a natural aging process. You're still going to need cataract surgery after LASIK, and it can be done.
And I've heard, and I'm kind of going off script here, I've
he'll
heard that
roll with
if you are a candidate for LASIK at some point, wait for the cataract surgery and have them done at the same time, or is that just a myth?
That's really great. So age comes into play too, right? So as we get older, there are things that cataract surgery can give patients because of the advanced implants we have now to help patients see better at distance and for near. So if you're in that 45 and over age group, LASIK may not be the best first choice for you. And so that's why going to a place that offers all these options, not just LASIK, you want to go to a place that offers a comprehensive approach to vision correction.
So you're saying the one procedure could fix both problems?
Cataract surgery can, whereas LASIK may not be able to, depending on a patient's age.
But if you're going to like a LASIK center and that's all they offer, that's what they're going to be thinking of. Where you're going to a place that's more holistically looking at the health of the eye, it's really an assessment of what will work for you.
I think there's more than 8 procedures that we offer just to help people get out of their glasses and contacts. And figuring out what your lifestyle needs are and matching it to what the technology can give you is really the key in today.
Is cataract surgery one size fits all?
Definitely not. So nowadays we have so many different options. We have lens implant options that correct astigmatism, correct for reading glasses, correct for after LASIK correction. So it's really gotten more complex in our diagnostics and our education and just presenting the options to patients.
Okay, so here's another question. You brought up glasses. Will I need reading glasses after cataract surgery? Most people out there are thinking, please, Dr. Chu, say no.
The answer is no. Okay, so not everybody's necessarily a candidate for those technologies, right? So I think it's important to go to a place that screens you thoroughly, educates you, so you can make the right decision. But it's important to know that you can get out of glasses for distance and for reading glasses after cataract surgery.
So like for me, I just started wearing glasses a few years ago.
You look so
and just so you know,
distinguished.
I only wear them so I can see. So you're saying, so you're saying I may be able to get rid of my glasses.
I know a guy.
Oh my gosh, can we follow
Wow.
you on the cameras?
Wow.
How exciting would that be?
I had no idea. I thought I'm just stuck with these forever.
So a lot of people might just be thinking, are they thinking I need glasses to see, but they might be dealing with a cataract?
Absolutely. Yeah, so there are, you know, I think it's important to get in and see your eye care professional,
Yes,
first of all.
yeah.
But yeah, you don't have to wait as long now for a fully, you know, cataract surgery is no longer a condition of older patients, right? We thought it was our grandparents got cataracts.
Yep.
But we see people in their 40s and 50s with some early symptoms that just want to have some freedom from glasses.
And an important question, is this covered by most insurance?
Yeah, if you have a cataract, it's a medical condition, and most people's insurance covers that.
Is there anything though that we can do to either like prevent it or delay it? Because, you know, I mean, surgery isn't like the best option for everybody.
Yep.
What can we do to really focus on our eye health?
Yeah, I think the most important thing is just take care of your general health.
Yeah.
So one thing that's been associated with cataracts is smoking, right? So minimizing smoking can slow the progression of cataracts.
Wow.
Was it dry it out or what is?
You know, it's the proteins in the eye that are changing. So I think if you put a lot of oxidative stress, so taking antioxidant vitamins, you know, protecting your eyes from UV light exposure excessively with good sunglasses, those things can help reduce the progression of cataracts.
What about the blue light? Do we talk about that?
Yeah.
I'm always
Yeah.
concerned because I'm just looking at a screen all the time.
I think that's a great question. I think the science is still early on that.
Yeah.
But I'm supportive of it. You know, I think these screens are giving a lot of wavelengths that we're not aware of. So if it makes your eyes feel more comfortable, I'm not against blue protection.
Wow, have we had a productive segment of Ask
I know,
Dr.
because we
Chu
had
today.
5 questions, and we asked you at least 25 questions in that segment.
Happy
You're
to
very
help.
good, very
I learned so
efficient.
much.
Good to see you,
Dr.
Dr.
Chu.
Chu.
Thank you.
Great talking to you.
All right, if you have questions about cataracts or your vision, you can visit the Chu Vision Institute at chuvision.com or call them at the number on your screen. We posted that contact information on TwinCitiesLive.com. You might see Kevin Dorn in the waiting room.
I learned a lot.
I know.
I really did.
Gotta go get it checked out.
Get rid of these.